At Dr. Sellars Educate, we help nurse educators and leaders advance their skills, pass the certification exam, and achieve excellence in nursing. Whether you're preparing for the CNE, CHSE, or CNML exam, our coaching programs, masterclasses, and study resources are designed to help you succeed with confidence. We provide a NCC-accredited continuing education, faculty development workshops, and practical strategies to strengthen teaching excellence, simulation, curriculum design, and accreditation readiness. We partner with schools of nursing and healthcare organizations to support faculty development, certification initiatives, accreditation preparation, and educational excellence. More than 5,000 educators have trusted Dr. Sellars Educate to support their professional growth and certification journey. Visit us to learn more and join a community committed to excellence.
The accreditation process is a very stressful one, and it doesn't have to be. Those colleagues that are focused and ready for that accreditation visit, they simply work differently. And that is what we're going to talk about in our snapshot today. What are those strategies that will help colleagues and leaders of nursing programs be more focused on not just submitting the paperwork and that self-study, also, how do we equip our faculty, our colleagues, to create this state of survey readiness? So it's not about running around collecting documents. It's not about having all of these prep meetings. It's about maintaining this state of survey readiness. For those of us that did spend some time in the acute care setting, you know this is very common. We talk about this as it relates to Joint Commission or CMS. We want to maintain this state of survey readiness. And that is what we're going to explore in our conversation today. Welcome back, everybody, to Dr. Sellars Educate, where our mission is simple. It is to support all colleagues that are on the journey to achieve excellence. If you're a nurse, if you're a nurse educator, maybe you are even in nursing school. This is what we know about preparation. Proper preparation is key. If you're in nursing school, then you know your faculty are working really hard to properly prepare you for the healthcare setting. We want to properly prepare you to make those safe patient care decisions so you don't have to stress out, you don't have to feel overwhelmed when you actually get to the bedside and those are your patients to make decisions and to provide safe care. We want to also make sure that we are properly preparing our colleagues, whether you're an educator or you are a leader. It's important that you have the tools, the resources, and the access to information that is going to help you achieve excellence. We do that in a number of ways. So for today, we're going to focus on the accreditation process. How do we ensure that we maintain the state of readiness? What are some of those missteps that we want to avoid? And specifically, what are the 5 key takeaways that are going to help you achieve the state of readiness no matter when that reaccreditation visit happens? First and foremost, as always, we like to start by taking a look at our Rooted in Wisdom devotional for nurse educators. And the reason why we designed this for nurse educators is because we know, first of all, there's a need for us to feel more inspired, more encouraged, more focused as we think about our journey towards nurse educator excellence. And then the second reason is because we want to make sure that you feel supported as you're moving forward on your journey. We know that there are many challenges, especially as you maneuver the CNE journey. And what we want to do is help you properly prepare so you can achieve that passing score on your very first attempt. That's our goal. The good news is we're going to support you no matter how long it takes as you move forward on your journey. All right, so let's take a look at our devotional, the one that we're picking for our time together today. See if I can get to it. All right, here we go. It's going to be, if you have it, if you have our devotion in front of you, you're going to turn to day 36. All right, so day 36 is all about teaching with compassion. And this is on page 38. The scripture is from Ephesians 4:32. Be kind and compassionate to one another, forgiving each other, just as Christ God forgave you. Our quote for today is from Mason Cooley. He says, compassion brings us to a stop, and for a moment, we rise above ourselves. The devotional says students face many challenges, both academically and personally. A compassionate educator recognizes struggles and offers support, creating a space where students feel safe to learn and grow. And that's what we want for our students. We want to create safe spaces where they can learn, they can grow, they can feel that we are their partner to help them stay focused on their journey to not only do well on exams and to pass the NCLEX, but also to be a strong nurse, a strong clinician that is collaborative and able to demonstrate these compassionate behaviors that we're talking about. I think that this devotional is very timely. I just posted a quote, and really it's more of a link to an article. I did include my perspective. Compassion is one of the three C's that I learned about when I was a new graduate more than 30 years ago. The other part, though, tied to compassionate is civility. So, our ability to treat others with respect, with kindness consistently, to respect their boundaries, to respect transparency and honesty. These are all core behaviors that are aligned with our professional image in nursing. Nursing continues to be the most trusted profession. We're going to talk about how accreditation aligns with not only our devotional, but also our ability to achieve excellence in the classroom and to also achieve that passing score on the CNE exam. This is a framework that we are basing our conversation on today related to the accreditation mindset. So, what is that mindset? Well, it's my ability to really create this survey readiness state where we as faculty have the resources that we need in order to do a really good job to help our students achieve excellence in the classroom and also for us to achieve excellence. So, where does that start? Well, first, we want to make sure we're hiring great faculty. We want to include our faculty in the orientation as well as in the interviewing process. We know we often have a search committee, and we want to be honest with ourselves. So, when we talk about creating diverse learning experiences for our students, it starts with our diversity within our faculty group. So, it's not just diversity when we think about ethnicity, which is important, it's also about background. What other backgrounds could really add to our faculty pool in a way that is going to enrich the students' learning experience? So, if there's a colleague that specializes again in comorbidity, socioeconomic status, even inequities in healthcare, that's a great asset to bring into our faculty group because it's going to create diverse conversations. So, hiring great faculty is a key strategy. So, we think about that and we explore what our needs are within our faculty group, and then we think about, based on our candidate pool, what could some of those assets look like? What could some of those specific background characteristics look like to help us create a richer faculty within our group? Good student outcomes, that's what we all want, right? That mindset is important because we have to make sure with our students that we are developing a program of study that is going to help them have that confidence that we know they need to have once they get into the clinical setting. However, we still see so many programs struggling. We want to be able to collaborate within the group, within our faculty group, in a way that is going to decrease that struggle. And that's what we're going to explore today. We're going to focus on accreditation confidence. So, what does it look like for faculty to have the confidence that they need to prepare for that accreditation cycle? What is it that every single nurse educator should know related to accreditation? So first, let's talk about alignment. So we are aligning with 5 different competencies. I know that's a lot. 5 different competencies. And the reason why this is important is I want you all, whether you're on the journey for CNE or you've completed your CNE, all nurse educators should demonstrate these competencies. As you're moving forward on your journey to achieve nurse educator excellence, you want to think about competency 3. How am I assessing and validating that my student outcomes are good? Our data should drive our decisions. Competency 1 is facilitate learning. How does my content in my course and my student outcomes align with my ability to truly engage students on this learning journey? A good example is going to be from Table 14.1 in the 6th edition, where the learning theories are outlined. And it not only talks about the definition or description of those learning theories, it also identifies specifically what are some of those teaching strategies that help my students align with the content that I am exploring with them to help them meet that learning objective. So remember that those learning objectives should be student-centered. Next is facilitate learner development and socialization. So speaking of connecting with my students, I want to think about how am I focusing on the learning needs that they have. I identify a gap, right? I could even possibly open a learning gap. when students realize that they don't have that deep comprehension of knowledge that they thought they did. And then what am I going to do about it? How do I engage in this continuous quality improvement cycle so that I am making decisions that are outlined in my systematic program evaluation? First of all, I'm participating in it. Then I'm using the evidence to really inform it, to really create it, really curate it based on what my programmatic needs are from my students and from my faculty. And then I'm going to demonstrate accountability. So I'm going to take the time to look at those standards, which we're going to explore. And competency 8, which is ensuring that I am ready, right? Having this state of survey readiness so that we're not wasting time and really building up our anxiety when it comes to survey readiness. So that's what we want to think about. How can I ensure that I am equipping myself with the tools, with the resources I need to maintain this state of survey readiness that we know is essential? That's going to help decrease our overwhelm, decrease our anxiety, and also help us create this a better safe learning space and better learning environment, not only for our students, but also for us, right? For our colleagues. All right, so let's take a look at this thought-provoking question and see what you all think. The scenarios that we have a nursing program consistently meeting benchmark targets for NCLEX pass rates, program completion, and graduate satisfaction. During the accreditation review, evaluators discovered that faculty rarely analyze these data or document curriculum changes based on the findings. Which concern would most likely prevent reviewers from reviewing the program as demonstrating continuous quality improvement? So we have A, faculty exceeded the benchmark expectations, making additional analysis unnecessary, and the ability to consistently meet program outcomes. B, the program demonstrated outcomes but provided limited evidence that faculty systematically used the results to improve the curriculum. Or C, accreditation focuses primarily on benchmark achievement rather than faculty decision-making and improvement of program outcomes. When you get to the CNE exam, you want to be clear about what is this question really asking me? Okay, and then the second part is, what is it that I know for sure about content that is included in this thought-provoking question? All right, so that's what you want to think about for every single question when you get to the CNE exam. Remember that you will have 3 options, okay? So they changed that. So 3 options on the CNE exam, and you can expect there to only be 1 correct option, okay? There may be 2 good options, but there's only 1 correct answer. So 2 distractors and 1 correct answer. And then what you want to be able to do is really think through, what is it that you know for sure? So if you read a question and you have no idea what it's asking you, just think about, okay, what is it that I do know? I may not know this question or this answer easily. I may not be able to choose the correct answer easily, but what is it that I know about this concept? All right, so if you chose B, give yourself a round of applause. B is correct. The continuous quality improvement process actually requires more than just collecting the data. We want to analyze it. We want to evaluate what are those trends, and then we want to decide what changes do we need to make? How do we need to improve it? And then did those changes work? This is why documentation of those changes is so important. Accreditation emphasizes the documentation of those improvement processes, not just simply successful outcomes. That's the core of continuous quality improvement. We want to be able to figure out, how did we get here, right? So how did we get here? We're excited when we have high NCLEX pass rates like this question is talking about. And we want to know, how did we get there? And then we want to explore, what are some ways we can get even better? Okay, our NCLEX pass rates are 95%, but they used to be 98. So what caused the 3% drop? 95 is still great, but what happened to our 98? Because what we don't want to do is to continue to see it slip and not know exactly why, what really happened to contribute to that drop in our NCLEX pass rate. So let's talk about these 5 key takeaways that we mentioned earlier. First is, we want to think about accreditation being a continuous quality improvement program and really focus, not just an event. Our ability to engage with our colleagues, even with our students, because we know they're a really important part of our accreditation journey as well. It starts with us really owning the fact that we have to look through a lens where we're always focusing on how we can get better. Now, we do want to celebrate our successes, and we want to think about what are our next steps to get a little bit better every single time. And it first starts with that self-awareness. So being self-aware about what data the assessments are telling us, so how our students are actually performing on the exams, the different formative assessments we're giving them. And then we want to think about what are some ways that we can improve our assessments, as an example, ways that we can improve the data that we collect from that formative assessment. What interventions can we integrate so that students have this deeper understanding of the concepts that we need for them to? All right, and then the next one is, let me make sure that it's advancing for you all. Okay, I thought it may not. Okay, so let's go back. So why does it matter? Well, it's really about three core elements as our foundation. The cornerstone. So we think about accreditation really being our cornerstone of excellence. It really bookmarks us and really creates this framework for us to achieve. We want to focus on what are ways that we're going to improve to create a more comprehensive learning experience for our students, making sure that we have the rigor, that academic rigor that we know is so important, so our graduates are fully prepared for the workforce. The three next components we want to focus on as to why it matters is with quality, consistency, and outcomes. We want to ensure that every single course that our student is taking, that they understand how it connects to the overall programmatic outcome. Specifically, when we look at how we design our courses, the sequence of courses, we want to be mindful of that, making sure the students are scaffolding their learning and we're partnering with them to be able to do that in a way that ultimately is going to help them make those safe patient care decisions. One thing about regulatory requirements from our Board of Nursing, there should be alignment with what our accrediting body is expecting of us and our state or regulatory requirement. It's also going to build trust with our community. When we have really good outcomes, NCLEX we know is a really important data point. And when our students show up in those healthcare settings and they're able to consistently make those safe patient care decisions, that's a positive, right? That's a positive for our healthcare partners because they can trust that we are providing the necessary education for the graduates, our graduates, to do well within their healthcare system. Every faculty decision creates accreditation evidence. I want to say that again. Every single faculty decision creates accreditation evidence. So what do I mean by that? Well, first and foremost, we want to think about the accreditation standards. There are specific standards that are outlined with for every accrediting body. Those are the benchmarks. And ultimately, I want you all to consider that being the minimum standard. Okay, that's the minimum standard that we are expected to adhere to in order for us to achieve success on our accreditation visit and in our accreditation journey. We also want to consider those clinical competency requirements for student readiness. We want to consider what content is included in our checklist. What specific skills do we expect our students to be able to demonstrate and at what point in our curriculum? That scaffolding of learning that I talked about earlier, we want to be intentional in mapping and aligning our concepts for every single course, right? So that's that horizontal alignment that Billings and Halstead talk about, as well as that vertical alignment. So how deep do we go related to respiratory distress, or when it comes to our cardiac disease processes, how deep do we go with our students in helping them understand exactly what's going on with the body? And then how does it show up across our nursing program? How does it show up in semester 1 versus semester 2, right? We want to make sure that we're going deeper, that we're scaffolding, building on prior learning when we look at Bloom's taxonomy, pages 188 through 190 in the 6th edition, to ensure that we are advancing their knowledge. Yes, we can expect for some of our exam questions to be at that higher level of difficulty, and we want to make sure our exam blueprint correlates with that expectation. Next, we want to think about documentation. Just like in the healthcare setting, if it's not documented, it didn't happen, right? It wasn't done. So we want to make sure we're documenting any changes that we're making, any quality improvement decisions that we have made. We want to document that. And then we want the evidence to reflect that we've made that change and to see the improvement that was a result of those changes that we made. We want to continuously evaluate our opportunities to improve our nursing program. That's truly the mark of excellence, is being able to kind of step back to look at the data, which is number three, and then helping that inform what changes we need to make. We, of course, want to also look at the evidence. So, what does the evidence say when we look at these wonderful toolkits that accrediting bodies provide to us, or even in the literature, the information that's published that really scripts out what our curriculum should look like, or what our evaluation strategies should look like, to ensure that we are truly using the evidence to make data informed decisions. So, how do we do that? Well, first and foremost, we know it's a challenge. So, you want to think about what tools are you using right now and what gets in the way of us being able to properly prepare and maintain this state of survey readiness. One good example could be that perhaps we are struggling with developing solid exam questions. So, what do we want to do? We want to make sure our faculty that are developing our exam questions, that they receive the training that they need. I mentioned earlier about access to resources. That's a critical part. So making sure that once we identify an obstacle, that we have a plan to remove it, to mitigate it as much as possible, to equip our faculty with the resources they need so that we can meet that benchmark, we can meet that specific standard. We also want to recognize those challenges, right? That's the first step in order for us to strategize and really collaborate with, as an example, a textbook vendor. If we've decided to have a textbook vendor or a vendor that we will partner with to help us have a more robust, have a more rigorous academic model, then we want to leverage whatever resources are available. So first we have to figure out what's the issue, and then we have to look at the data. And that last step is making a decision that is based on evidence, that is data driven, and that we're fully informed about options and resources that are available. Number four is faculty alignment. Now, this is key, especially when it gets to our site visit. It actually matters more than perfect documentation. I can tell you that there are so many colleagues that we have supported on this journey at that college level that really get stuck. They get stuck in trying to make sure that we have all 100 pieces of documentation, which are important. However, what we know is that it is a process that is focused on continuous quality improvement. Now, we want to do that internally, but that is the role of the accrediting body. They're looking to make sure that we are aligning with those standards. And it should be an experience where we're learning, right? We're learning how to do it better. We want to make sure we meet those standards as they are described, but we also want to make sure our faculty are aware of any gaps that we have. And then what was our plan? What was our action plan to make it better? So how do we do that? Well, faculty alignment first starts, as we mentioned earlier, making sure that we're selecting our faculty that are going to support our mission, are going to support our goals within our nursing program. Some other challenges that we see is time constraints, documentation overload, looking for extensive records, maybe that we didn't do a good job maintaining, coordinating multiple stakeholders and schedules. Now, that is a challenge that I'm going to talk about a little bit more in a second. And then navigating through the evolving accreditation criteria. We talked earlier about proper preparation. Not only is that important with C&E, it's also important with accreditation. So proper preparation starts with, number one, having a consistent accreditation team. Now, I don't say committee, I say team, because in my mind, team means that we're focused on a common goal. A committee says, yeah, we may know the goal, but do we truly own it? Do you think about a sports team, right? They are committed to a common goal. Even those bench players, right? They still are rallying around the team. They're still in the game. Every good coach will tell the bench players that they're in the game too, to achieve a common goal. And there's a certain component of grit that aligns with this objective too. Our ability to truly engage in alignment with these standards, it starts somewhat with that internal grit. There are so many colleagues that are part of the curriculum committee that have a lot of grit when it comes to making sure our courses are designed the right way, that is evidence-based, that aligns with the specific curriculum model, whichever one we choose, and to make sure that faculty are equipped with the information that they need. One minor example is a syllabus template. So when we look at 10 different syllabi and we have determined that they follow a different template, that's always a red flag for our evaluators, right? We want to make sure that there's consistency, as we mentioned earlier. And not only that, it just makes it easier for everybody when there's a template, a syllabus template that we all follow. So sometimes it's the simple things that become the big things. And then the other part I want to mention is when it comes to coordinating multiple stakeholders and schedules, we know that's a challenge. So, what strategies can we use? Actually, one of the deans that I work with just posted this message to the board and shared that this is our date, our upcoming date for our accreditation visit. This is the window that you have to share any feedback. So, being properly prepared also means that we are mapping out our schedule. So, if we know our site visit is November the 1st, then we should work backwards. We want to make sure we're checking all the boxes. For me, I like to create a checklist. That's also how we support our deans and directors. We develop a checklist. So they already know these are the specific benchmarks that you should be meeting, that you should be checking off your list by this date. This is going to help decrease that anxiety and also help them better manage their time because we know it can get very hairy, especially as it gets within those 30 days of your site visit. Accreditation is really all about student success. That's why we all show up in our workspaces every day in nursing academia, even as a nurse leader, is to help students achieve success. We know our students are serving our community ultimately, and we want to best equip them to be able to do that. The strongest accreditation reports tell one story: how faculty decisions improve learning, clinical judgment, NCLEX success, retention, and graduate readiness. That's the story. It's not a secret. This is the strategy. This is the framework that we use to help ensure that we are survey ready and ultimately that students have great outcomes and that they are successful. So when we think about solutions, it boils down to three different concepts. Number one, being proactive. Number two, having systems in place. And number three is having this overall mindset about survey readiness. It's about being able to instill that confidence and creating this culture of confidence and accreditation. Our accrediting body is our partner, right? That accrediting body, whichever one you choose, they are our partner. They establish those standards that we will meet in order to validate and ensure that we are providing the best possible nursing program, not only for our nursing students, but for our entire community. Our students serve our community. We as nurse educators serve our community. The best way to do that, proper preparation, having systems in place, having a team that is focused on this level of accreditation readiness, this mindset about accreditation readiness that will decrease our anxiety, make preparation manageable, strengthen the collaboration we're going to have with each other as we create this continuous learning environment. Confidence comes from knowledge and preparation. We have to have both. And our ability to engage on this journey of confidence in the accreditation cycle starts with leadership, and then it ends with our ability to celebrate with our students, with our faculty, the success that we're going to achieve. Thank you all for joining us. We hope this snapshot has been helpful. Make sure you let us know about your accreditation journey. We know that everybody's journey is different, and your ability to truly partner with your colleagues around the table and within your academic setting starts with that mindset. It starts with us deciding which part are we going to own, which part are we going to contribute to in order to validate that we indeed have a solid nursing program. We look forward to seeing you in our 60 days program. It took me almost 8 years to get CNE off of my bucket list, but the good news is it only takes you 60 days. We hope that we will see you in our 60 days program or our upcoming snapshot. Have a great one, everybody. Take care. It took me almost 8 years to pass the certification exam. As a nurse educator and even as a nurse, I knew I wanted to achieve my certification in my specialty. And when I became a nurse educator, it was loud and clearly stated that NLN C&E is the hallmark of excellence when it comes to being a nurse educator. So I knew it was on my bucket list. I had no idea it would take 8 years for me to actually get it off of my list. And the reasons why is because first and foremost, I didn't know where to start. Okay. I had no idea what resources to use, and it was hard to find a community to support me that would go along with me on this journey to achieve CNE success. The good news is you don't have to go through the struggles that I did. We have a community with Dr. Sellars Educate specifically designed to overcome and break through those barriers to achieving CNE success. It starts with number one, the right resources, number two, the right experts, and number three, compressing time. 60 days, that's all that you need to accomplish your goal of passing the Certified Nurse Educator exam. The other point I want to remind you all of is that life happens. Sometimes we get off track. And for that reason, when you join CNE in 60 Days program, you have access to the recordings indefinitely. They never expire. So no longer do you have to wait. Do you have to put it off like I did? You're ready now. And we're ready to help you. We're walking along with you every single step of the way until you are successful. Go to our website, drsellarseducate.com. You're going to see CNE in 60 Days right on our homepage, and we look forward to seeing you in the program. Oh, one other point, there's nothing else to buy. Once you register for the 60 Days program, your textbooks, which are going to be Dr. Caputi's CNE review book, Billings and Halstead, as well as your study workbook that includes the 7-week study plan, are going to show up on your front doorstep. Okay, so that's the other benefit. So we'll see you over in the CNE in 60 Days program. Have a great one, everybody.